we start out with the thigh thrust. You might see this as the thigh thrust test, the P4 test, the post, let's see, what do they call it? Thigh thrust, P4 test. I think there's something else they call it too, posterior, something else. But anyway, it's all really the same test. One thing important to pay attention to on these sacroiliac joint testing, the pain provocation, is remember we talked about earlier intra-articular or peri-articular? So conceptualize it when you're doing the test. What am I testing? Am I testing compressive loading through the joint? Or am I testing tensile shear loading through the ligaments around the joint, right? And so if we look at the thigh thrust test, essentially what we're doing is doing a shear test. We're doing a tension-based test because we're using the patient's thigh to push the innominate posterior relative to a stabilized sacrum, right? So what I'm doing is testing the ability of the ligaments around the sacroiliac joint to handle that tensile loading. If it's painful, it has a decreased loading capacity. If it's not, it doesn't. So to do this test, so take this leg down. We're going to test his right side. So I'm going to be standing on the opposite side. One leg down here. Can we put this on? Perfect, yeah, just like that. I'm going to take one hand, and this hand is going to be my stabilizer under the sacrum. Right, so the weight of his body is pressing down on my hand. That's going to keep the sacrum stable, and then gives me, also elevates the sacrum a little bit, so that as I push through the thigh, I get some shearing through the joint. Remember the kind of the orientation of the joint. We want to push at a little bit of a lateral angle with it. It's posterior and slightly lateral with that. All right. To take like getting your hand in a good position, you kind of make your thumb line up on your hand here. If we come in first, so I'm going to come in with my thumb and get my thumb under the lateral portion of the sacrum, and then just flip my hand. That's much more comfortable than trying to reach in there and palpate and find things, right? So I'm going to take his leg, I'm going to rock him over to the side towards me. Got my hand here, bring it right up on the sacrum, bringing it back down. I've flipped my hand underneath now so that my hand is blocking the sacrum. See how my forearm is in line with his thigh here? And I'm going to put pressure down through the thigh to see if that reproduces his pain at all. You might start out with, so especially if your patient's kind of irritable, start out with just a little bit of pressure and release and see if that's okay. That's okay, put a little bit further. If that's okay, then you can kind of really push in and maybe hold for a minute or two, or not a minute or two, but 30 seconds or so, and see how that feels. Okay? And then when you come back out, kind of release, let him back down, and then bring his foot down. All right? So that would be the thigh thrust. The SI gapping and compression. This gets shown differently. Like